Hello, my name is Utkweken, and in the next few minutes I will be talking to you about the norovirus, what it is, how it is transmitted, and how you can protect yourself from it. The norovirus is also known as the stomach bug. Now, you may have experienced this yourself, or you may have heard of somebody who was sick with the stomach bug. It is the most common cause of viral gastroenteritis in humans. And in the United States, it is the #1 cause of diarrhea and vomiting outbreaks. It is highly contagious and is easily transmitted. It affects people of all ages. However, 3 out of 4 norovirus outbreaks occur in long-term care facilities like nursing homes. Especially the elderly and the immunocompromised patients are likely to get very sick and die from norovirus. It infects 267 million people worldwide and kills about 200,000 people. Most of those deaths occur in developing nations and is due to severe dehydration. It is responsible for 50% of all foodborne outbreaks of gastroenteritis in the US. On the right side, you can see a transmission electron micrograph showing about 10 viral particles. 18 viral particles are enough to make a person very sick. So you can see that it doesn't take much of the virus to make a person very, very ill. As mentioned, it is highly contagious, and it is most contagious when a person is sick with it. It is carried on stool or vomit of the person who is sick with it, and touching your hand to your mouth after your hand has been in contact with a contaminated surface or object is the easiest way to get it. Direct person-to-person transmission makes up about 62 to 84% of all cases. It is suggested that after a person vomits, the virus is able to go airborne, allowing easier and faster transmission. So the virus can aerosolize even after a toilet flush of diarrhea or vomit. The virus can land on surfaces, and indirect contact via contaminated food or water with the virus will also get you sick. On the right side, you can see an image by CDC showing you different ways of contracting it, such as shaking hands with somebody who's ill with it, touching surfaces, doorknobs, etc. So as mentioned, it is an inflammation of the stomach or intestines or both, which is called acute gastroenteritis. Some of the most common symptoms are diarrhea and vomiting, as mentioned, nausea, stomach pain, fever, and headache. A person usually develops symptoms within 12 to 48 hours of being exposed to the norovirus. Most people with norovirus illness get better within 1 to 3 days. If you have norovirus illness, you can feel extremely ill and throw up or have diarrhea many times a day. This can lead to dehydration, especially in young children, older adults, and people with other illnesses. And as mentioned previously, about 200,000 people die because of some of the complications associated with it, such as severe dehydration. There are several diagnostic methods. The most commonly used diagnostic method is quantitative reverse transcription, PCR. It is very rapid and you get results within a few hours. Another method is ELISA assays. These aren't used much because they present false negatives 50% of the time, so they lack specificity and sensitivity. And the samples that are needed are stool samples or vomitus or food and water samples. However, food and water samples aren't preferred because you would need a high dose of the virus contained within it. So most commonly preferred clinical specimen is stool. There is no specific medicine available to treat norovirus infections, and it cannot be treated with antibiotics since it is a viral infection and not a bacterial infection. To prevent dehydration, it is recommended to drink plenty of fluids. And most people, as mentioned, get better within 1 to 3 days. And there is no vaccine available either. Some methods of prevention include proper hand hygiene, washing fruits and vegetables thoroughly, when sick, not preparing food or caring for others, cleaning and disinfecting contaminated surfaces, and washing laundry thoroughly. Thank you for listening.